Hey everyone, welcome back to TV5 News at 9. Joining us this morning, please help me welcome Dr. Brian Ye. Dr. Ye, thank you so much for being here. How are you today?
I'm doing well, and you?
I'm doing great. Thank you for coming on and talking to us a little bit about proton therapy and breast cancer. So to start us off, Dr. Ye, how would you describe breast cancer and what it is?
So breast cancer is when there are cells in the breast that basically don't know to stop growing. And they can form a tumor, and they can also spread out parts of the body and cause trouble. Breast cancer is more common in women, but men can also get breast cancer, although it is rare in men.
All right, thank you for explaining that. Who might be greatest risk for breast cancer? I know you said it can happen in both male, females, but what are you seeing more of?
So the people who have the highest risk for breast cancer are people who have a family history of breast cancer. And this is most likely due to some inheritable genes, mutations in genes, that we know increase one's risk. We have not identified all the genes which increase a person's risk of getting breast cancer, but we do know there are some. For example, there's some genes called BRCA1 and BRCA2, and certain mutations in those genes, and these are inherited genes, can increase a person's risk of breast cancer. So family history is probably the most significant risk factor. There's other risk factors as well. For example, exposure to estrogen. So either women who've been exposed to estrogen, who, for example, have a later menopause. So they've been exposed to estrogen for for a longer period of time in their lives. Yeah. Actually, when women are pregnant, they don't have as much estrogen, and so women who have fewer children, who are pregnant less often, they're also at an increased risk of breast cancer. Or women who use estrogen supplements. So we do know there are other risk factors as well, not just hereditary factors.
Interesting. And do you have any idea of what could cause breast cancer besides maybe just a lengthy family history?
So all cancers ultimately result from something called DNA damage. Every cell has DNA in it, and the DNA is sort of this instruction booklet. It tells the cells what to do, when to grow, when to stop growing. Yeah. And ultimately, it's from DNA damage. And the reason why we get DNA damage is actually we live in an environment that unfortunately causes DNA damage. So, for example, ultraviolet light from the sun damages DNA. Unfortunately, oxygen itself can damage DNA. So what happens is, breast cells, as they reproduce and multiply, they also have to copy their DNA. And in doing so, sometimes mutations can occur. And eventually, those mutations can result in a cell that doesn't know when to stop growing. So actually, BRCA1 and BRCA2, they're actually genes that are involved in DNA repair. So because we live in a DNA damaging environment, our bodies are constantly repairing DNA. But when we have reduced capacity to repair DNA damage, that increases our risk of getting cancer, because cancer ultimately is a result of DNA damage that is not repaired. So typically, patients who have mutations in genes that are involved in DNA repair, they're at an increased risk of getting breast cancer or other types of cancers as well.
Okay, yeah, thanks for laying that out. So, Dr. Ye, why might one person consider proton therapy, and is that a good option for breast cancer?
So proton therapy is a good option for breast cancer, especially for breast cancer that's on the left side. The reason why is because actually your heart is on the left side, when we use radiation therapy to treat breast cancer, because the heart is on the left side, it's actually very, very close to the breast, there's a little bit of radiation that the heart can get. And the heart actually is sensitive to radiation. Radiation can result in heart disease. And so proton therapy is a more focused form of radiation that results in less radiation therapy to the heart. If I can share a slide, I can show you those differences.
Yeah, absolutely.
So this here is a slide on the right that says PT, that's central proton therapy. On the left is IMRT. IMRT actually stands for a certain form of X-ray therapy, which is sort of considered the standard therapy that's available for breast cancer around the country. Okay. There's only about 40 proton centers around the country, so proton therapy is not as readily available around the country. We do have a center here in Flint, but here you can see with X-ray or normal radiation therapy, you can see here the heart is in this middle, the gray area that's in the middle of the chest, but you can see it's a little bit to the left. In medical imaging, everything, the left and the right is flipped. So actually, this is a patient with left breast cancer being treated on the left side, although on the screen it looks like it's on the right side. In medical imaging, left and right is always flipped.
Okay.
You can see here the heart, which is this gray area in the middle, does have a little bit of blue, which is a low dose of radiation, and then even here a little bit of green, which is a little bit higher dose of radiation. Here you can see with the proton therapy, the heart basically gets almost no radiation. The radiation is much more focused. It's much safer for the heart. The lung also gets less radiation therapy as well. The lungs are these dark areas that's right behind the breast. You can see here, even proton therapy, you can get less radiation to the lungs. So proton therapy is appropriate for breast cancer, especially for patients with left-sided breast cancer. And the reason why is because we can reduce the amount of radiation going to the heart and the lungs.
That is really good to see. Thank you for giving us that visual. It's just, I think, is medical miracles. It's really cool. So Dr. Ye, if a patient wants to find out if proton therapy might be their treatment option, how would they go about that?
So the best way is to give our center a call. We have nurse navigators who can speak with patients and go over the details of their situation, of the details of their cancer, and to determine whether or not proton therapy is appropriate for them. You can call our center at 855 MyProton. That's MyProton, or you can go to our website, which is mclaren.org/proton treatment. But the best way is to just give us a call and let one of our nurse navigators go over the details, of your situation, the patient's situation, to determine whether or not proton therapy is appropriate or not.
Dr. Ye, this has been very informative. Thank you for coming in this morning and explaining proton therapy in relation to breast cancer to our viewers. Thank you.
Thank you very much for having me.
Absolutely. You're welcome anytime. And if you want more information on this topic, just go to our website, WNEM.com, and go to the Hot Links section.